Right, we're live there. I pressed the go live button too soon because I say too soon. I'm supposed to do this at 7 o'clock and having trouble logging into Facebook. I think Facebook is not happy with my performance and have openly said they're not going to recommend me to their friends because I've done something wrong. Not entirely sure what I've done wrong, but I've obviously done something wrong. So apologies, Facebook, if you're watching for my transgressions. It's not the first time. So I think I'm live anyway. I've got some questions to be answered in more ways than one, but let us just focus on the plastic surgery questions that are to be answered here this evening. And those plastic surgery questions go something like this. I've written them all down, and here they are. Because the date today is the 24th of Feb, so this is the ones for the 24th of Feb. So the first question is, if you've got a question, you can ask me directly, by the way. But if you haven't, then I've got some that have already been asked. If I have breast surgery, do I have to sleep on my back, and why? A lot of people will say this to me, and I've never said it to them. So there's someone out there telling them that they need to sleep on their back. And it's not me, because I don't tell people they need to sleep on their back. So in answer to the first part of the question, if you have breast surgery, do you need to sleep on your back? The answer is no. I don't tell people to sleep on their back. But what happens, I think people do, and I don't know if it's the nurses or their friends or what. But anyway, and I think if people are telling you to sleep on your back, it's not an unreasonable thing to say, because I think what they're saying is, and particularly often tell you to sleep with a few pillows to keep elevated, because that's going to help with swelling. So it's not a bad thing to say. The thing is, I think that some people do find it hard to sleep on their back. So I think I think sleeping is more important than worrying too much about sleeping on your back and sleeping with pillows, because I think in the night you're going to move over. Some people can't really sleep with many pillows. But what I do is get people to have some kind of support. If you're having a lift or if you're having a reduction, I will tape you up, which will give you support. If you're having an augmentation, then you will be put into a bra immediately post-op, and it's good to wear the bra day and night. So the bra is good to give you some kind of support to help with swelling. So I use some kind of support, whether that be a bra or the tape, and I tell you to sleep however you want. Your body will naturally sleep in a comfortable position. You won't be able to sleep on your front. I don't need to tell you not to sleep on your front, because you won't be able to sleep on your front because it'll be uncomfortable. So it's kind of, you can say don't sleep on your front, but I don't think you have to sleep on your back. I think it's fine to sleep on your side because it's important to be comfortable. So yeah, that's why people say it, I think, because of swelling, but I don't say it. I just let you sleep however you want to sleep. So just listen to your surgeon, and if your surgeon says it, then ask them why they've said it, and you better do what they say. Is it normal for there to be some discharge/weeping from the wound a week after mastopexy at the T-junction of the scar? Yes, it is. That's the tightest point, the T-junction, where the vertical scar meets the horizontal scar, and if you're going to get any wound healing problems, you often get wound healing problems there. So I would say that is pretty normal. And nothing particularly to worry about, as long as it's only a little bit of weeping. Obviously, again, if I'm your surgeon, come and see me or send us a photo. But if it's speak to your surgeon about it, and obviously make sure that you're okay. But a bit of weeping at the T-junction is normal, and even a little bit of breakdown because it's tight. That's the whole thing about mastopexy, well, this is a mastopexy. The whole thing about mastopexy has got to be tight. Otherwise, you want it to be tight, because if it's not tight, then that's not going to lift and tighten your breast. You're doing it to tighten the breast. So sometimes it is, you do get a little bit of breakdown. Lorena is here keeping the numbers up. So that's what we want, Lorena. Thanks for keeping the numbers up. Thanks for messaging. I can't quite see what you've messaged. Is it waving? I think it's waving hands. Okay. Lovely to see you, Lorena. I hope you're well. And I think we're seeing you tomorrow, are we? Yeah, so it'd be nice to see you. how tight should the bra or support garment be following surgery? This is another one for your a lot of this stuff is kind of for your surgeon to answer. If someone's, because a lot of this stuff is kind of implying someone's just had surgery. So if you just had surgery, it's always best to speak to your surgeon. Don't ask me, because who am I? I'm just some random guy. So do ask your surgeon if you've had surgery. So I will tell you what I tell my patients, but if you're not my patient, you better take it with a pinch of salt, because especially stuff like this, everyone's a bit different. People have got different views on garments and what have you. My view on garments is they're for support, they're for comfort, they help with the swelling, they make you feel protected, and they're for comfort more than anything. I use the word support rather than compression. Some people talk about compression garments, especially when they're doing liposuction or what have you. They talk about compression garments. I don't talk about compression garments. I talk about support garments. So I would say they've got to be comfortable, and we don't want any red marks digging in. And this is particularly true for tummy tucks. So for tummy tucks, you really don't want a lot of tension on the abdomen, because you don't want to reduce the venous drainage from the legs, because that will increase your risk of DVT, which is a serious complication after a tummy tuck. So you want if you take the binder off, an abdominal binder off, and the person goes, "Oh my God, thank God for that, I can breathe," then that was on too tight. So it's got to be supportive, it's got to be comfortable. And the abdominal ones are adjustable. In fact, so are the bras. We've got 3 sets of hooks and eyes, so they're adjustable. So do it for comfort, and don't think that because we put it on a certain way in theatre, that's the right way to have it, because we often just put it on in theatre on what we kind of think is comfortable, but you might get swelling, it might be too tight, it might be too loose. So feel free to adjust it for support. And again, this is from my practice. I think other doctors might have different views on garments and how tight they should be, or whether you use them or not. It's not a universal consensus on whether garments are used and how tight they should be. So it's best to speak to your surgeon to see what they want to do. Can you recommend any alternative treatment instead of gynaecomastia surgery? Weight loss. Yeah, weight loss. Well, you've got to think of causes of gynecomastia that you can change. So weight loss, steroids. So if you're a sort of bodybuilder and you're using steroids, that will help with your gynecomastia. And in fact, it's not an alternative form of surgery. You should do that really before surgery. So if you're overweight, that can be a cause of gynecomastia. If you're overweight, the other thing is you can get pubertal gynecomastia if you are going through puberty. So get through puberty, would be the alternative form of treatment. So yeah, you look for reversible causes of gynecomastia, and those are kind of like the main. Well, there's quite a lot of drugs as well. So you look at a drug history to see if your marijuana being one of the recreational drugs, but also medical drugs that we use to treat conditions can cause gynecomastia. So there are, we'd look for treatable causes, but the vast majority of causes of gynecomastia are what we call idiopathic, which means there is no cause. So if you have idiopathic gynecomastia and your weight is good, then no, I don't have any other forms of treatment for idiopathic gynecomastia, only looking for causes that you can adjust. But I don't think instead of surgery. Yeah, no. Oh, well, I suppose you could look at those non-surgical fat machines, the freezing and the radio frequency and what have you. I suspect they would struggle with gynecomastia because the fat's often quite dense and there's dense breast tissue, but I don't do that sort of stuff. So that, I guess that's an option. You could look at the non-surgical fat machines, non-surgical fat removal machines. I think that's what they're called. Cool title, non-surgical fat removing machines. We ain't got none at my clinic, but there are people who do have them. They might work. Could give it a go. The problem with them, they're so expensive. That's why I haven't got them, because they're so expensive. And in my experience, they're quite subtle, the results. If they were expensive and good results, I'm happy. But expensive and subtle results, I think you're onto sticky one with patients personally if you're doing expensive things that aren't getting aren't getting significant results. But anyway, that's an option. Since you asked the question, I will answer it, and there we go. If I book a consultation for breast surgery, will I have the consultation with the surgeon who will perform the surgery? Yes, you will. Yeah, you will. Yeah, we don't do that sort of seeing a different surgeon type thing. So there's me, Costas, and Sam, three plastic surgeons, all plastic surgeons, all fully trained. And whoever you see, they will be the one doing the surgery. They will be your consultant, and you will be looked after by them. If there's any issues or anything, obviously we help each other out. But if you're not going to turn up on the day and see some random surgeon. You hear horror stories about that, but that don't happen on my watch. My wife had a fall Saturday night and cut her forehead. Is there anything you can do to make it so it doesn't scar much? This person sent a photo of it, which is good, but they didn't let us show the photo, which is understandable. But yeah, big scar on the forehead, sutured. So obviously been to A&E and had it sutured. There's not a lot I can do really to make that scar better acutely. So acutely, you need to get it cleaned. You need to get it sutured, which will be done on an emergency basis in sort of A&E or what have you. It sounds a bit. I know it probably sounds a bit funny, but you would probably want to wait for about a year before you come and see me or a plastic surgeon, at least 6 months, to see if there's anything we could do. It's a difficult scar because it was in an unfavorable orientation. It was kind of like that. Forehead, you want the scars to be that way. So it's kind of the wrong way. But you want to get it, you just want to get it healed and mature before you would think about scar revision. So it's a bit of a funny situation that you can't get emergency treatment. You can't get a plastic surgeon to stitch your wife's cut if she falls on Saturday night and cuts her head. You're not going to be able to find a plastic surgeon to stitch it. You'd have to go to A&E and get and be stitched by whoever would be stitching you. There's no kind of, that's private medicine in the UK. Really, we don't really have a emergency or even an urgent sort of service for problems that happen like that you need kind of A&E type help with. You can't really phone the local private hospital and say, can I come and get stitched up by a plastic surgeon? They wouldn't accept you. There's no sort of on-call plastics in the private hospitals. I mean, you're on call for your own patients, but you're not on call for new patients. So that is not something that we actually do in the UK. We don't have a emergency. I think there's a market for it, especially in hand injuries, which I don't do. But I think having to wait for days to get your hand sutured is not great. But I think there's a market for it. Not maybe so much in cuts and things like that, because yeah. Anyway, yeah. So sorry, you have to wait for probably at least 6 months and probably a year before you consider scar revision, if at all. You might find the scar's fine, but there's nothing you can do in the early stages. You can do scar management. So once it's healed, you get massaging it, moisturising it, massaging it, that sort of stuff. I suppose that is probably helpful advice, which I could have said in hindsight, which I didn't. But I'm saying it now. So if you're watching, but a moisturizer massage once it's healed, I usually wait for 6 weeks once I've done surgery, but you need to make sure that it's healed nicely before you start massaging it. Oh, God, right. I've got to be honest, that was quite an ordeal because it took me an hour to get it logged into Facebook, but I got there in the end. So if no one's got any questions apart from Lorena, who's got the wave, thanks for that, Lorena. Don't know what I'd do without you. I will go and put the dinner on. Believe it or not, I'm not going to be back here next Tuesday because there's a football match at school, so I'm not going to be back here next Tuesday. But I hope you'll all cope. Hope my followers will all cope. But stay strong, and I'll see you the week after for another thrilling installment of the Q&A that is the Q&A. There goes Freddie. Right, okay, hasta la vista. Nice to see you.